The purpose of today is to just make sure that all of you are who have been participating in the revision process for our community impact agenda. We want to make sure that you are aware of all the different pieces that have come together, and we're very excited about this agenda that will be leading us forward. So when we look at the modern United Way community impact agenda, what does that need to look like? And I think our slides are supposed to be advancing. Looks like we might be having a little technical difficulty there. But I'll go ahead. One of the things that our board had done back in 2018 as we went through our strategic planning process, we wanted to make sure that our agenda was aligned, but also we wanted to make sure that we were going deep and not necessarily wide in our investments, because we wanted to make sure that those investments were going to be able to make a lasting impact. We also wanted to make sure that we were sticking with organizations for a longer period of time. And then two, we stepped back and looked at our impact agenda that we were operating under, and it had turned 10 years old, and certainly things had changed in a decade. And then we had COVID on top of that, so we knew that we needed to step back and really reassess. And two, through COVID, what we saw were how inequities in our community, it just really lifted those inequities that were along race lines, really amplified those. And so we wanted to make sure that we were being very intentional in how we were addressing those. We've always, had that as a portion of what we were doing, but we wanted to make sure that it was done with intentionality. So we really stepped back and said, okay, so where and how do we need to go so that we can make that greatest impact, a measurable impact in our community? And so where we have landed is really around, and I'm so appreciative of this graphic illustration, but at the center of everything are our bold goals. And we'll get into those here in a moment, just as a reminder. But looking at that from an economic mobility, a health, and an education perspective, and really honing in on some things and understanding that from an economic mobility standpoint, basic needs is foundational there. When individuals are in, families are in crisis, we need to make sure that we're addressing that, but that we move quickly from there to that longer term support and solutions perspective. And then from a health standpoint, understanding that your environment, making sure that that is safe, and looking at those adverse childhood experiences and how those impact health, that was all connected in, and we view that to be foundational there. So whenever we step back and we think about, what exactly are those bold goals that are underpinning all of this, the very top one is decreasing the number of individuals who are living below self-sufficiency by 11,000. And when we're talking about self-sufficiency, as a reminder, that means that those individuals, those families are able to take care of their basic needs, meet all of their, housing, utilities, food, those types of things, those costs, childcare, that they're able to do that on their own without public or private assistance. And that is something, when you look at our community, there is a gap between what is the federal poverty guideline and somebody actually being self-sufficient. So we're wanting to close, meet that obvious need of below poverty, but also that arena that is in between. Also, we have two goals that we view as sub-goals with that bold goal that really help support. And one of those deals with decreasing the number of individuals living in poverty who are unemployed by 75%. And then the second has to do with housing and decreasing the number of cost-burdened low-income households by 6,000. And so for that definition of cost burdened, that means that those families who are cost burdened, they are spending more than 30% of their gross income on housing and housing related costs. So that includes your utilities, your taxes, your insurance, all of those things that are necessary to really provide safe shelter. And so we're wanting to make sure that we are decreasing that, because if somebody is cost burdened, then that means that if one of those unexpected expenses arises, a car breaks down, it really puts them at greater risk of not being able to meet their needs from a basic perspective, and it also puts them on that precipice of possibly moving toward homelessness. And we definitely, and that's something we saw through COVID, is we definitely want to make sure that we've got those measures in place to help prevent homelessness as well as address current homelessness. So what are some of those interventions that United Way is already doing in this arena? And I will step back and say that from an agenda perspective, this is really about us being able to bring together that external work that we are funding in the community, but also that internal work that we are doing and making sure that those are aligned. And so underneath all of this, we're transitioning to what we are calling vision councils, which will include subject matter experts as well as our corporate partners and donors in the community, so that we've got a nice blending of that. And so we will have one for Cherokee. We've already launched the one in Union. And then we have one around economic mobility, one around health, and one around education for Spartanburg County. But when we look at those current interventions, what we see, I'll just highlight a couple here. One that has been just extremely successful thus far is our community resource coordinators. They are embedded across the community in a variety of locations, from schools to universities to workplaces to communities. And so those individuals are doing deep case management. So they are staying with those families, those individuals, and they are working with them over a longer period of time, 6 months, a year, 2 years, really helping them stay committed to the plan that those individuals develop for their own self-sufficiency. That Homeless Prevention Fund, which we got lots of use out of during COVID, because what we saw is as people's incomes were turned off because of maybe they were a hairstylist and their business was closed for a portion of time, or maybe they got laid off, but they still needed that assistance for their rent or mortgage. And so we were able to step in there. You've probably read some things around the partnership with Litter Heroes, and that has been extremely successful thus far, and the second cohort has begun. And then that Opportunity Housing Collaborative, the action plan, is ready to be launched there, and we're excited about that. And then being able to provide that transportation to work through Ride United, and that is actually getting people to work, but also to school. So we're very thrilled with the success of those, and feel like that those interventions are doing a good job of filling in some gaps that were in the community, but also being able to bring those voices around the table with those collaborative efforts and those task force. As I mentioned, this is all about being grounded in equity. And so we want to be very cognizant that if we're going to reach those long-term goals, that we need to be going deeper than just the top level statistics and indicators. We need to be disaggregating those so that we can make sure that we understand what's going on and looking at that along race lines to make sure that we are meeting all of those different needs in our community. And you might notice that we have shifted some language here. And really, when we've always talked about it from a financial stability standpoint, and that is still very core and key. But we also recognize it's not just about being stable there, but it is about that pathway and moving up that economic ladder. And so making sure that the programs that are in place and the interventions that we are promoting are actually doing that, helping people move forward in their lives. And the other piece that we recognize is that we have to have that two-generational approach and prioritizing those particular efforts and initiatives there, because it's great to be doing things with children around education, but you can't separate those children from their families. And so we want to make sure that as we're doing things to help build those strong leaders of tomorrow, but that we are also wrapping around those services that those families need for them to be stable, to be thinking about how to show up as the very best parents that they can, helping reduce some of those stressors and helping them navigate as they move their families forward so that we can begin to break those cycles of generational poverty that have really held back many in our community. And then, as always, we want to make sure that measures are there and that we are holding ourselves and our partners accountable for the results. And for us, we made the shift, I think it's been 3 years ago now, to results-based accountability. And really that ends up focusing in on 3 questions. How much did we do? How well did we do it? And is anyone better off? Did it make a difference at the end of the day? Because it's great to have programs that are serving a lot, but if at the end of the day, if people are not better off, that's not going to be an effective investment of our dollars. And we want to make sure that we are investing in the very best possible. So at this point, I'm going to transition things over to Hannah, and she's going to give you a deeper dive as we're talking about that basic needs and economic mobility area. Thank you.
Hey, good morning, everyone. My name is Hannah Jarrett, and I am Director of Economic Mobility Strategy here at United Way of the Piedmont. So like Paige mentioned, basic needs are foundational to families' ability to be economically mobile and eventually, hopefully, financially stable. So really looking at someone's ability to keep a roof over their head, afford their rent, afford their utilities, have food for themselves and their family are critically important to then taking that next step towards those longer term goals and action items to achieve longer term economic mobility and stability. So we must have that healthy, strong safety net in our community to address those needs. And so that will continue to be a priority of our work. Some data to our work is very data informed. So throughout this process of updating our impact agenda, we certainly heard from the community, got input from many voices across sectors, across socioeconomic statuses, but we also looked at what does the data tell us. So for basic needs, we look at 211 referral data. This is just a snapshot from June of 2021, but we do see a common trend across months. We had the biggest number of referrals were for housing assistance and electricity assistance across our 3-county footprint. We also look at individuals who are experiencing homelessness or at risk of experiencing homelessness, because shelter is a foundational basic need. In 2020 in Spartanburg County, and that's just a reason that we included Spartanburg County data is because that's what we have available for these numbers. So in Spartanburg County in 2020, over 3,000 individuals entered shelter in our community, most of them entering shelter from a homeless situation. So they were living in a place not meant for human habitation. So these data points really illustrate that we do have a lot of needs just related to someone being able to cover that food, shelter, utilities. So our basic needs impact goal is that individuals and families in our community can meet their basic needs and build towards self-sufficiency. And so they have that secure foundation that they can then build off of towards their goals and their steps to be economically mobile. We really want to focus on seeing results that related to coordination. So leveraging all of the strengths and resources and capacity across our agencies and across our safety network in our communities to make sure that we are coordinated and being able to address people's, working together to address people's needs. And then we also want to make sure that there are those connections to longer term case management. So once that crisis need is addressed, once that foundation is a little bit more secure, making sure that we quickly refer and connect people to case management, working towards those longer term needs and goals. So basic needs, again, is that subset of economic mobility, that strong foundation. So for economic mobility, really working, like Paige mentioned, on that journey, on that pathway to financial stability for individuals and families in our community so that we can break those cycles of poverty, in generational poverty, and see better outcomes for future generations. When we look at the data related to economic mobility, 29% of individuals across Spartanburg, Cherokee, and Union counties are living below self-sufficiency. For those of you who might be familiar with data, you might notice that this is much higher than the poverty rate that we usually talk about, because as Paige mentioned before, of course, we want to help those individuals who are lowest income, who are experiencing poverty, but we also want to address those who are maybe living in that gap between poverty and being self-sufficient. So that's where this 29%. So these 29% of people in our community are struggling or unable to afford their basic needs, which means that as crisis occurs in their life, they're going to fall further and further behind, experience more and more crisis, which is going to make it harder and harder for them to be economically mobile. When we look across our counties and looking by race, we see a common trend that you are more likely to be living below self-sufficiency if you are a person of color. So if you are Black or Hispanic, you are more likely to be living below self-sufficiency than if you are white. Home ownership in renting, it's more affordable to be a homeowner in our community than it is to be a renter. In our community, we find that 80% of homeowners are white compared to 15% Black and 3% Latinx. So there's a huge disparity and a lot of work that needs to be done in this area to make sure that people of color in our communities do have more opportunities to be homeowners and therefore have more opportunity to live in housing that they can afford and to build those assets and that wealth that they can then pass on to future generations. We know that home ownership is the #1 source of intergenerational wealth in our country. So if we really want to impact families' lives in the long term, we can't ignore their ability to build that wealth and that asset so they can then pass on to future generations. Diving a little bit deeper into housing and what that looks like in our community. Like Paige mentioned, cost burden refers to a family or individual spending more than 30% of their income on housing costs. In our community, 48% of renters are cost burdened. 18% of homeowners are cost burdened. So again, that shows how it's much more affordable to be a homeowner in our community than a renter. And then 41% of low-income households are cost burdened. So that doesn't, if you tie all that together, if you're a renter, you're much more likely to be low income, you're much more likely to be a person of color, and it's going to be harder for you to have the additional income to be able to weather crisis and unexpected expenses, because so much of your income is being tied up in housing and housing costs. So when we look at our economic mobility impact agenda, we really want to reach our overall bold goal. As Paige mentioned before, our goal is all of our work is aligned towards our bold goal. So we really want to make sure that our economic mobility work is addressing that goal to decrease the number of individuals living below self-sufficiency by 11,000. Looking at this comprehensively and holistically though. So making sure that people have education and job training and hard and soft skills to be able to go out and start a career and increase their opportunities to bring in more income for their family, so that then they're able to afford their basic needs without that public or private assistance. We also want to remove barriers to those opportunities. So for example, access to transportation and quality affordable childcare can often be barriers that people encounter that limit their opportunities in other areas of their life, particularly employment. We also want to make sure that we are supporting programs that encourage savings and asset development that then lead to that generational wealth that can help alleviate and end generational poverty that so many families in our community experience. And then specifically related to housing, we want to develop collaborative housing strategies that increase affordable, safe, quality housing for people in our community, particularly those who are low income. I do just want to shout out the word collaborative. We know that if we want to achieve our bold goals for our community, if we want to achieve our basic needs and economic mobility goals, then we have to be working together. So really uplifting, prioritizing, and thinking about how we can all be working together as a community to achieve these goals and to help more people in our community by building on the strengths and capacity of multiple organizations coming together. So that's the basic needs and economic mobility portion of our agenda. If you have questions, please put them in the chat or in the Q&A, and I will now turn it over to Savannah to go over education.
Thank you, Hannah. Hello, everyone. My name is Savannah Ray, and I am our Director of Educational Engagement and Partnerships here at United Way. And so as we talk about education and economic mobility, we recognize that educational attainment influences an adult's success in life, and that we can impact that trajectory of an individual by focusing on education and thinking about that early on. So education really begins at birth, and even before birth, leading up to the first time that child even steps into a school classroom. So as we look at our early childhood data, the first data that I have on the screen is our Spartanburg data, and we're more intimately connected to this data with our early development instrument. But based on our EDI, we see that about half of our children are entering kindergarten ready. And then when we dig deeper into that data, we see that there's a disparity between readiness for our white students at 50% and then readiness for our Black students at 36%. And so when we talk about being ready, or any of the indicators that we're looking at, not only are we wanting to do better, but thinking about how we support the group of students, children, families that we lag in. So when I talk about on track for readiness, that means children are tracked for school success in 5 domains as it relates to our EDI. That's physical health, social competence, emotional maturity, language, and then communication skills. Now, I talked about us having the EDI data for Spartanburg County. And while we don't use the EDI statewide, there is a tool called the Kindergarten Readiness Assessment that's used in our publicly funded schools. And so for Cherokee and Union County, we have our KRA data. And in 2019, 2020, about 30% of our children in Cherokee County entered school ready. And then Union County was 39.3%. And that was compared to about 39% statewide. And we did see that dip in the pandemic, and I think we'll continue to see those impacts with that data, but that's where we were before the pandemic. So along with looking at our early childhood data leading up to another critical period is our third grade reading data. So at the end of third grade, our children really should be shifting to reading to learn, not continuing to learn to read. So that's one of the areas that we look at to see about proficiency. And so again, on the screen, you can see where we were in Cherokee, Spartanburg County, and Union County. Again, like I mentioned with our data for early childhood readiness, we did see what we call our COVID slide, and some of those indicators are really all of those education outcome areas and indicators. And so we want to do whatever we can not to respond on the back end of third grade, but how are we preparing students even leading up to that third grade reading outcome area? So as we continue looking at education, following that child, we talked about early childhood, third grade reading, and really leading up to high school graduation, and not only making sure that our students are graduating, but they're graduating college and career ready, that they're prepared for those next steps, and that we're equipping them along the way. So when we look at our 3-county footprint, this is our education for residents age 25 or older. So when we average that, that's 82% across our 3-county footprint in comparison to where we are nationally at 88%. So again, I think about economic mobility and how we're preparing our youth, how we're preparing our families, how we're creating a culture of education so that we are providing greater chances of economic mobility once they graduate from high school, and think about either that advanced certification, career, college, whatever those next steps are. And then finally, the last area is our bachelor's degree attainment. And again, as we mentioned earlier, we're looking at bachelor's degree attainment, sharing the stats, but also where are we seeing those gaps among certain populations? And so when we look at our population of our white community, and then we look at our Black and Latinx communities, we're seeing those disparities. So again, how are we early on working so that we are supporting certain populations right here where we see our Black and Latinx populations, so that we aren't seeing those gaps in educational attainment. So we shared bachelor's degree attainment, but again, when we talk about education, we're leading up to any type of advanced certification, associate's degree, and bachelor's degree. So when we look at our impact goal in education, there are 3 key areas that we are focusing on. So first, I talked about early childhood education. So we're focusing on the early years, interventions and experiences for children in 0 to 5, birth to 5, making sure that not only are we looking at that early childhood space, but that there's a strong parental engagement as a part of those interventions, because we know that our parents, our caregivers, our family members that are inside of the home with their children are the most essential teachers. And so we have to set expectations early, ensure families, caregivers are equipped with the tools to support their children and also engage with them. And we don't want to wait until they enter into the classroom. The next area is that third grade reading point that I shared, and we want to and need to provide support leading up to that outcome area. United Way partnered with the Spartanburg Academic Movement a few years ago and piloted a summer climb intervention that allowed students to have additional instruction for reading over the summertime and not just waiting after third grade where we saw the deficiency for post first graders. And so what we saw is for those rising, our post first grade students that participated 70% of the time, we saw some promising results. So how are we supporting those type of interventions as well as after school activities that have a strong literacy component for children grades K through 4? And then the final area is in out of school time. So when I say out of school time, that's just another word for after school and summer programming. And that's a key area too. When we talk about heading towards graduation, being college and career ready, thinking about that next step, how are we surrounding our adolescents? And we've seen that there's been a lag in services for those students. And we are, like Hannah said earlier, encouraging collaboration. So there's a out of school time collaborative at SAM that I have an honor of co-leading. And so when we talk about collaboration, prioritizing those organizations that are being collaborative in Spartanburg County's collaborative network, but then also in Cherokee and Union, where there is collaboration, we're going to see that understanding that there's greater power when we're working together to yield the best results for our community and our families. So I am going to hand it over to Heather.
Hi, good morning, everyone. One thing I want to point out before we move on that I just noticed is actually my error, is that the second area under education, we had expanded that to be K through 5. So for those of you who might be taking notes, please mark that down. Our updated impact agenda handout that you all will be getting does have the correct K through 5th grade, but I just wanted to make that point because I realized that this was a slide deck that hadn't been updated. So I apologize for that. Okay, moving into health. When we talked about health and we thought about what are some of the areas that have the greatest impact on a family's ability to thrive and become self-sufficient and economically mobile, of course, the thought around accessing affordable and culturally appropriate healthcare was the place where the conversation went. When we had our community conversations, there was more than 50 respondents that indicated that access to healthcare was an issue within their community or within the population that they served. And then, of course, when we went to the data, we recognized the impact as well. And so thinking about someone, if they have access issues, they're, of course, then going to delay care. And when you delay care around a health issue, what typically happens? It gets worse and it gets worse. And so by the time you seek out that medical assistance, you've gone this prolonged period of time with this unaddressed health issue. You might have been missing days at work because you were already sick. And now that you're working to address your health issue, it's more costly, it's more time intensive, and it could impact your ability to continue working or have negative impacts with your employer. We've seen that happen as well. So when we go to the data, we of course looked first at insured. So who in our communities are insured? And with the data that we have, the breakdown, of course, there is a disparity. We expected to see that, although I'm hopeful to get to a day where it's just the opposite. And you can see that across people of color, there is a broader disparity around if they have access to insurance or not. And that could be through their employer, through a spouse's employer, the availability of even knowing where to go, or if they can afford insurance through the Affordable Care Act. Want to mention also, for all of the data that we've shared across the Hispanic population, some of it is underrepresented because, as you would imagine, I think a few times we've done this, people have said, well, why would it be underrepresented? And I think there's a few reasons. There's, of course, a language barrier, but there's also a trust barrier as well. And so just making sure you keep that in mind when you look at any of our Latinx data that we provide in any of our areas. But certainly looking at that uninsured. So how are people going to access care if they have no form of insurance to help pay for it? Will they even be accepted by certain providers if they don't have that insurance? We also talked about prenatal care. You know, Savannah mentioned in her comments that learning starts really even before birth. Learning really starts in the womb. And so making sure that our children are born happy and healthy and whole, so that they are able to have the opportunity to be economically mobile and self-sufficient. So we look at prenatal care and the disparities in the data there. And when we talk about adequate prenatal care, the data around receiving inadequate prenatal care indicates that these individuals received 5 or fewer prenatal visits. And so for anyone who's been around a pregnant individual or had the experience, you know that there are very much greater than 5 visits. So these are individuals that are receiving inadequate care because they're not receiving enough visits, or it's delayed visits, or perhaps they can't get to all the visits, let alone afford them. So we need to make sure we're removing those barriers around mothers receiving prenatal care. So when we talk about access, we look at the whole body, head to toe, teeth to. We want to make sure that we can increase access to primary and specialty care for those individuals that have been marginalized and need access to the care. We also want to make sure we've increased access to prenatal care and those supportive programs that wrap services around the family, because that is probably when a child is most vulnerable, is prenatally and at birth. And so being able to make sure that they're not just getting access to the medical care, but the supportive programs that exist in our community to wrap around that family, to talk about parenting and talk about the importance of education, and really have that family engaged in the life of that child before it arrives on the scene. Making sure that there's access to dental care, both preventative and restorative. I think the one data point that we have that makes a lot of people kind of hold their breath is when we talk about the fact that 11% of people in Spartanburg County have no teeth. You know, that is not just a health issue, that's also an employability issue. And so making sure that there are places for people to go to save those teeth, but also do some of that preventative work. Of course, access to behavioral health care. A lot of those strategies are overseen by our behavioral health task force, but we also do programmatic investment through our impact agenda to increase access to behavioral health care. And finally, making sure that that health care is culturally appropriate and informed health care, because making sure that when you're working with someone around someone, some of the complex things that go into healthcare, helping ensure that they understand the information that you're giving them and they know how to care for themselves when they're outside of that physician's office. When we talk about safe environments, another key component of our safety net, we want to ensure that there are programs in our community that are combating ACEs upstream, and we do have those efforts happening, as I mentioned, through our behavioral health task force and through work, particularly that's being led by the Spartanburg academic movement within the schools, but also making sure that we have those programs and that safety net for our survivors of abuse, and making sure that they have a place to get to for immediate care and ongoing care. We look to all of those adverse childhood experiences which can impact a child, and we all grow up, right? So if we have any of those 10 core things in our background in our early childhood years, those have transformed us and changed us. They change how we respond to our environment around us. In addition to that, a United Way out of Southern New Jersey and Philadelphia, Paige always knows the right name of it. A United Way really dug deep with ACEs, and they identified 5 additional adverse childhood experiences that impact a young person's life. And those are shown on the outer edge of the circle. But knowing that all of these different things that go on through a child's life that they literally have little to no control over can impact who they are as adults. And so we've got programs in the community that are working with children, but we also have to have programs that are helping work with those children once they've been that survivor, or those adults once they've been in that survivor realm, to make sure that they can really live their best life and be able to thrive. So we see disparities when we look at ACEs. The biggest disparity that we see is when you look at greater than one ACE across people of color. That's where the largest disparity is. So how can we work to get preventative, but also provide those wraparound supports to help young people as well as adults heal and move on to thrive? So our safety net programs that fall into this area are programs that work to not just strengthen community efforts around the prevention of violence and abuse, but they also provide those services that help maximize the likelihood of recovery of survivors. And so traditionally in this area, we've not had funding limits. We of course will continue to have our funding minimum in all 3 counties. So in Cherokee County, the funding minimum is $5,000. In Union, it's $5,000, and in Spartanburg, it's $15,000. And for safe environments and basic needs, our safety net programs, there's a maximum funding limit of $25,000 for those programs. That's something you'll see new this year. In addition to that, as I wrap up and before we go to the Q&A, and please make sure you're putting those questions in the chat, just want to make sure that everyone on the call, because I noticed a few agencies that in the past maybe we have or have not funded, this opportunity for funding for United Way in 2022 is open and competitive. So regardless of if you've received funding in the past, if you feel that you fit within our impact agenda somewhere, reach out to one of the UWP staff members on this call today to schedule a conversation, because we want to make sure that whether you've attempted to apply for funds in the past or not, that you're definitely putting your best foot forward. And we'd love to have that conversation with you about your program and where you think you fit best in our impact agenda. We can talk through the results-based accountability, because one thing that we didn't dive into as deep on this session is that RBA. So what are those metrics? But we have metrics behind all of these different areas. So we want to make sure if you come in and apply that you can actually measure the impact that you're having. And those would be great conversations to have early 2022. Our letter of intent process will still open in the April-May timeframe, with grants being due usually in the August timeframe. And again, those will be competitive open grant cycle. So anyone can apply that's eligible. We have a few organizational criteria that we look at with your organization around governance and finances. But this is the first time in a while that we've been able to really open the doors. And we're hoping that that helps with our mission and our commitment to equity, and to make sure that we're providing programs and service support where it's needed, where we see gaps, and most importantly, to organizations who are doing some of this work that we haven't been able to fund in the past. So I'm going to stop my screen share and see if there are any questions live going on in the chat that we need to answer, or if we've been keeping up with things.
I believe we've been keeping up with things.
That is good. So we thank you all for coming today. We do still have some time for questions if there's something on your mind. If you feel like it's a deeper conversation, again, as I mentioned, reaching out to Paige or Savannah or Hannah to set up some time to have conversation with them is the best way to get your foot in the door and move forward. Okay, so let's see. Hannah also put her email in the chat. So if you need to contact her, Savannah and Paige, maybe you'll do the same as well. We will send a copy of the PowerPoint. So we also have a really pretty document that Alex's brand experience team was able to put together. And it really makes the impact agenda look gorgeous. So we appreciate her and her team for that as well as this PowerPoint. You know, that's something I couldn't do on my own. That was definitely our brand experience team. So everybody give a little cheer in your home office or your work office to that team, because we love the way they're able to make all of our work look beautiful. It's good to see folks from all across our 3 counties and some new programs, but I don't see any questions that look like they haven't been answered.
And if things come to mind, you know, obviously we are always here to support and assist. And I will just reiterate, one of the questions that was in the chat was, or in the Q&A, dealt with, you know, what are going to be the expectations around disaggregating data. We are actually going through right now, and it will be into the early 2022. We are actually revising the applications. And so the education, economic mobility, and health programs will have grant applications that will be very specific to those areas. So I can't, you know, answer definitively. It's going to be, you know, you're going to need to be able to provide this or that. But one thing that we have been doing is we're meeting with a group right now called Resource Solutions to help us develop some training so that we're all operating off of this sort of the same plane regarding race, equity, and inclusion, and how to make sure that the programs that we are offering, the way we're going about doing our work, that it is in support of equity and it is not having any unintended consequences that are actually exacerbating current inequities in the community. And so as we move forward there and get those things solidified, we will be getting that information out to you. I will go ahead and share that there will be some baseline training that if you are wanting to be a United Way partner and receive grant funding, there will be some things that you'll need to do along with that training to participate so that you would be eligible to apply. So just wanted to go ahead and put that out there.
All right. Well, thank you all for coming this morning. We were really excited to be able to share this in a larger group setting. We've talked with a lot of different community partners, kind of one-on-one. Paige and I have been busy on the Zoom circuit. So if we look a little windblown, it's because we're just landing from a prior Zoom. So we've talked to a lot of our community stakeholders. We've done broader trainings on this for specifically our funded partners or potential new funded partners. And I think we finally made it around the world, and this is us landing for the last time. So we look forward to having exciting conversations with some of you one-on-one, and are just really excited to see what the next 10 years brings us with all of this collective impact work that we're doing together. And we thank you. We thank you for the role and the work that you do in the community, one person at a time.